Hollywood's elite transformed the red carpet into a stunning showcase of high fashion as the Academy Awards ceremony returned in full glamour. The biggest stars in entertainment arrived at the prestigious venue wearing designer gowns and tailored suits that set social media ablaze with fashion commentary. This year's ceremony marks a significant return to the traditional glitz and glamour that defines Oscar night, with attendees pulling out all the stops for one of entertainment's most watched events. The red carpet arrivals drew millions of viewers worldwide, with fashion critics and fans alike dissecting every sequin and statement piece. The Academy Awards remain one of the most globally watched entertainment events, with the red carpet coverage often generating as much buzz as the awards themselves. Tonight's fashion choices will likely influence trends and designer collaborations for months to come as Hollywood continues to set the standard for luxury entertainment culture. Prime Minister Keir Starmer is expected to unveil a comprehensive support package for households struggling with soaring heating oil costs that have skyrocketed since the outbreak of conflict between the U.S., Israel, and Iran. Families across the UK have been hit particularly hard by the sharp price increases, with many facing impossible choices between heating their homes and other essential expenses. The support plan comes as energy analysts warn that geopolitical tensions continue to drive up oil prices globally, creating a cost-of-living crisis that threatens to deepen economic hardship for millions. Rural communities, who rely more heavily on heating oil than urban areas connected to gas networks, have been disproportionately affected by these price surges. The Prime Minister's intervention signals growing government concern about the social and economic impact of energy price volatility on British households. Details of the relief package are expected to be announced within days as pressure mounts for immediate action to prevent a humanitarian crisis this winter. American anti-abortion groups are launching an unprecedented campaign to shift Britain's pro-choice consensus, galvanized by the controversial death of activist Charlie Kirk. These U.S. organizations are funding and coordinating with British activists to challenge the UK's established abortion laws and cultural attitudes. The transatlantic movement represents a significant escalation in international anti-abortion activism, with American groups bringing substantial resources and organizational experience to British shores. However, the campaign faces the formidable challenge of overturning decades of settled British public opinion that broadly supports abortion rights. The influence of American religious and political groups in UK domestic policy debates raises questions about foreign interference in British democratic processes. Political analysts warn that this coordinated campaign could polarize British politics in ways previously unseen, importing the divisive rhetoric that characterizes American abortion debates. The success or failure of this movement will likely determine whether other contentious American political issues begin crossing the Atlantic with similar organizational backing and financial support. A deadly meningitis outbreak in the Canterbury area has claimed 2 lives, including a university student, while 11 more people remain seriously ill in hospital fighting the potentially fatal infection. Health authorities are working frantically to contain the spread of the bacterial disease, which can kill within hours if left untreated. The outbreak has sent shockwaves through the local community, particularly affecting university students and their families who fear further transmission. Medical teams are conducting urgent contact tracing and offering preventive antibiotics to anyone who may have been exposed to the infected individuals. Meningitis outbreaks are particularly dangerous in close-contact environments like universities, where the disease can spread rapidly through dormitories and social gatherings. Public health officials are urging anyone experiencing symptoms including severe headache, neck stiffness, fever, and sensitivity to light to seek immediate medical attention. The Canterbury outbreak serves as a stark reminder of how quickly infectious diseases can devastate communities and highlights the critical importance of early detection and rapid medical response. Growing numbers of British patients are abandoning the NHS for private healthcare as a patient watchdog warns of an emerging 2-tier medical system that threatens the founding principles of universal healthcare. New polling data reveals a dramatic surge in people paying out of pocket for medical treatment, driven by frustration with lengthy NHS waiting times and delayed procedures. The trend represents a fundamental shift in British healthcare consumption, with middle-class families increasingly viewing private medicine as a necessity rather than a luxury. Patient advocacy groups warn that this exodus of those who can afford alternatives will further strain NHS resources while creating dangerous inequalities in healthcare access. The development undermines the core NHS principle that healthcare should be free at the point of use for all citizens regardless of wealth. Healthcare economists predict this trend could accelerate the decline of public healthcare if not addressed through significant investment and reform. The watchdog's warning comes as the government faces mounting pressure to tackle the crisis before Britain's cherished universal healthcare system becomes irreversibly divided along economic lines.